Magazine publisher and entrepreneur Judith Mancini is sharing captivating conversations with experts in their field about the latest trends in our ever-changing world to help you become healthy, wealthy, and wise. Judith Mancini Today will spark your interest and inspire you to lead your best life ever. And now, here's Judith.
Hello, everybody. Judith Mancini Today is sponsored by Basic Brands, Inc., in providing the highest quality specialty products in the natural food industry. Visit basicbrandsinc.com and enter JMT15 for your 15% discount on your first order, including their best-selling vitamin E ointment, which helps restore moisture and elasticity to your skin. Hi, everybody. It's Judith Mancini. I'm so happy to be back podcasting again with all of my good friends. And today I'm bringing you a very special guest, Dr. Sayeh Eshraghi. And I said it wrong again, Dr. Sayeh Eshraghi.
That was perfect. Hi, Judith. Thank you for having me on. It's my pleasure to be here.
Thank you. I just want to give everyone a little bit of your background. Board certified in internal medicine and also has a degree in pharmacy as well. I keep finding out new things about her all the time. And she is striving and has succeeded at bringing back the art of medicine where the doctor-patient relationship is the pillar of one's health care. So I'm going to let her tell you about her education, and don't forget about your being head of residency.
Oh, wow. Okay.
And also when exactly you started the wonderful LA Wellness Boutique.
Thank you, Judith. So yes, it's been quite a journey. As everyone knows, getting a medical degree is not something that just kind of rolls off and happens in a few years. It has been quite a journey. I actually was born here in the US in Northern California. My parents moved to South Africa when I was 4 years old for their, I guess, midlife adventure at that point. And so I grew up in South Africa amongst good old South Africans, 11 official languages there. So quite a cultural difference compared to here. I did my pharmacy degree, completed that, and thought, you know what, there's just not enough patient interaction having just the pharmacy degree. And so I went ahead and decided to move on to doing medicine. I finished all my medical education and got my degree there in South Africa. I actually did a year of residency there as well as a compulsory year of community service where, you know, we go and treat the underprivileged in different villages.
Oh, how wonderful.
Yeah, it was quite an experience. I have quite a few interesting and funny stories about those years. Then I met my husband who lives here in Los Angeles, and I guess the rest was history. I moved here, went to Santa Barbara Cottage Hospital for my residency. I did my 3 years internal medicine residency at Santa Barbara Cottage. And as you mentioned, final year of chief residency there. So, you know, the whole process has been a great journey. I have loved every minute of it. Once I finished my residency and got my board certification, at that point, I actually decided to do inpatient hospital medicine. And I was a hospitalist at Kaiser Permanente here in Woodland Hills for quite a few years until I fell pregnant with my first child and my belly could just not take the night shift anymore. And so I then transitioned to the kind of outpatient setting, which honestly I love. And that's what I've been doing for close to 8 years now.
Fabulous.
Yeah.
But we want to hear one of these little stories a little bit later about going around to the villages, which is so important these days. And I did not know you had done that. So that's quite interesting to me. But now you've opened your own practice and you opened a very special place, LA Wellness Boutique. Tell us about that and how long you've been doing that.
Yes. So after practicing, in the outpatient setting for a few years and realizing that, I need more time with my patients. I can't do this 15-minute in out, not being able to spend time, talk to them, hear about their day, hear about their challenges in life. And, honestly, patients like to hear about mine. It's this relationship that we develop. I decided to then branch off and open up my own practice. First, I went into concierge medicine with another doctor partnership. And then beginning of 2020, right before COVID hit, I took the big leap to open up my own concierge practice, named it LA Wellness Boutique here in Calabasas. And primarily, I do focus on women's health. But obviously, I do have my gentlemen that have followed me through the years and have continued to be my patients. It is a concierge medical practice, and that really is what has given me the opportunity to spend an hour and a half, if I like, with a patient, sitting and hearing about, their different risk factors, being able to give them comprehensive examinations, and treating the patient really as a whole. LA Wellness Boutique, the goal for me was to have a place where we could kind of include a lot of services under the umbrella of the medical field. So there's the medical practice side of it, there's the anti-aging side of it, there's the aesthetic side of it. And really it's given me so much gratitude just being in this office and seeing my patients. It's brought me so much quality of life, and I'm hoping it's done the same for the patients as well.
Oh, I'm sure it does. I have to be fully disclosing everything here. I am a patient of Dr. Eshraghi's, and that's why I think she's so wonderful, and that's why I asked her to be my first guest relaunch on my podcast. So let's talk about women's health specifically today, as I know I have quite a few women listening in. I've discovered between a lot of my friends do not go for an annual physical or even a blood test to see what's going on. And we're all interested in longevity, and we're getting up there in years. I'm not divulging mine. We are. And I just, thank you. I think quite a few of my friends told me they just don't go to the doctor. They just feel everything is all right. Or maybe they make a gynecologist appointment once a year, maybe every other year as we age. And I think it's dangerous. My philosophy is catch something as soon as it happens and start treating it. So
before it happens.
Yes, absolutely. Let's go through what you do. Thank you.
Sure. The whole point. And I think that what you've touched there, Judith, is so important, and often it is neglected. You are absolutely correct. Because if we feel well, why should we go in and visit our doctor when we can, be sitting there for hours and, wasting our time? Well, really, the annual physical exam, I believe, is the most important aspect of healthcare and wellness. That is the time we actually sit down and we find out what every individual is at risk of developing, and picking up those risks early on so we can then strategize and we can develop a treatment plan, a health plan with health goals, and really get on top of it before disease sets in. Once disease sets in, it's so much more difficult to cure it, per se. We may be able to control it, but why don't we do something that we don't allow disease to set in the first place? And that's where the annual physical comes in. So what an annual physical essentially includes is a very detailed history taking from the patient, a detailed physical examination. And you know what, growing up in South Africa and, getting my education there, we did not have the luxury of CT scans, X-rays at every corner, all these different diagnostic tools, which of course, are important, especially in modernized, advanced medicine. But really, we used our bodies, hands, ears, our different senses to examine a patient. And I still think that is vital. That is vital. And so a full examination would also be included in that physical. And then it comes the diagnostic tests. So a basic EKG, let's see where your heart is at. Are you having maybe irregular rhythms that you are not feeling? Is there any evidence that maybe your heart is enlarged from high blood pressure that you have, again, not felt? Or just picking up that you have high blood pressure at the physical examination. So many of these illnesses, we do not feel any symptoms until it reaches a point of we're developing complications. For example, high blood pressure. We don't feel it, and somebody may have high blood pressure for years, maybe even decades, and not know it. And slowly that disease process is building without us even knowing. So having that physical exam and picking up somebody has high blood pressure, that's where we treat it before it starts leading to problems to one's heart. And then also two further aspects that are important to the physical exam. One is blood draw. I definitely think once we reach a certain age, an annual physical, including labs, is so important. We look at your blood counts. We look at your organ functions, so the kidney function, liver function, your bone marrow function. We see what your nutrition is like from the electrolytes, from the protein levels in your blood, calcium levels. We can pick up early diabetes or being at risk for diabetes, high cholesterol. These are all such important labs that need to occur on a yearly basis for us to keep an eye on it. One big one for women especially is the thyroid. I get so many women coming to me around, perimenopausal age saying, I feel tired, my skin is horrible, my hair is falling out, I do not sleep, I must have a thyroid problem. 99% of the time, it's not a thyroid problem, but it is important to check, because should it be a thyroid problem, that is so easily treatable, and it would not be picked up without a blood test. And then lastly, the importance of the physical is our screening tests. So depending on our age, depending on our risk factors, depending on our gender, there are different screening tests that we recommend. So for us women, mammograms, bone densities, these are huge. The number of, early breast cancers we pick up with just yearly mammograms that are curable is phenomenal. And really, if we don't do those mammograms, we won't know until the breast cancer reaches a stage where it's not curable. So let's get on those tests. Let's do those. If it's a tiny lesion, we remove it, and that's that. Let's not wait to a point where we need to do radiation, double mastectomies, chemotherapy, and then, God forbid, have our life at line. So yeah, those are kind of the multiple aspects of the yearly physical.
So let me ask you a couple of questions here.
Sure.
In the blood test,
Mm-hmm.
does it necessarily mean that you may have something going on in your body, rather an infection or maybe a tumor growing, if your white blood cells are elevated beyond the normal? Most labs now, and you're very good about sending the results, most labs do explain highs and lows, but they don't tell you what they actually mean.
Absolutely. And so, as far as the blood tests go, the entry level tests, which one of them is the blood counts, which includes the white blood cell count. Those give us a general feel of what's going on. They may not be very specific. So for example, you mentioned the white blood count. White blood counts go up, yes, with infection. They can go up with some blood cancers. They can go up in times of stress, there's some sort of a stress in the body, like an autoimmune process or something else that we need to further investigate. And people that are on steroids actually have elevated white counts. So that will give us a clue that there's something more we need to dig into. And usually an elevated white count, if it's not obvious that someone's having a urine infection, or they have a rash that is a little bit infected around it, we actually delve further and do some more blood tests to find out what exactly is the underlying cause of that white blood count being elevated.
Now, what about a red blood cell elevated number?
So the red blood cells are the cells that help to take oxygen from our lungs and transport it to all the different organs in our body. When someone is low in red blood cells, that's when we call it anemia. Now, there are a myriad different causes for anemia. It could be nutritional, like iron deficiency, B12 deficiency, folate deficiency. It could be that you're losing red cells somewhere that you may not be seeing. For example, if you have an ulcer in your stomach, you may be losing blood cells and not noticing it. You may have a bad tummy ache, but the anemia tells us, oh, well, maybe this tummy ache is related to blood loss somewhere. Or it could mean that the red blood cells are being destroyed for whatever reason. They could be crushed and the levels come down. And often those are kind of autoimmune diseases where our own immunity attacks our red cells and destroys them, so the red blood cells come down. So there are multiple, the lists are endless for causes of anemia. Most commonly, though, I would have to say it's iron deficiency anemia. And that's the one I think most people, non-medical people, are aware of, that, oh, I'm anemic, I must be low in iron. Yes, most of the time that is the cause, but it's probably best that we delve further and make sure that there isn't anything else going on.
Well, I think a lot of women now are complaining of autoimmune diseases or ailments. And it seems as if they're adding more to that list all the time. They're coming out almost yearly with a new autoimmune disease, or rather classifying as that.
Sure, there are multiple autoimmune diseases. So just to be clear, what autoimmune disease is that one's own immunity is attacking either a cell or an organ system or some form of a tissue in our body. Something like classic rheumatoid arthritis, some types of rheumatoid arthritis are autoimmune. Lupus is autoimmune. Sjogren's disease is autoimmune. There are multiple causes for autoimmune diseases. Some forms of colitis are autoimmune induced. A lot of it can be genetic, as far as if we're at risk for autoimmune diseases. Once somebody has an autoimmune disease, they're at risk for other autoimmune diseases. So if we find out that somebody has a thyroid problem and it's because of an autoimmune disease, Hashimoto's, for example, that's the kind of medical term for it, they are prone to other autoimmune diseases. For example, lupus, or, there are myriad, there are a lot of them. So it tells me, if I have a patient with one autoimmune disease, I actually need to keep an eye and make sure others don't develop.
It sounds very complicated with these autoimmune diseases.
Sure.
Now, a lot of people, as they grow older, experience arthritis, but that's a different kind of arthritis than rheumatoid arthritis.
Absolutely.
Is that true? What is the difference between them?
All right. So rheumatoid arthritis usually is an autoimmune disease, and we actually pick that up with blood tests. Where we find the antibodies and we find the rheumatoid factors that are responsible for causing that type of arthritis. Rheumatoid arthritis often develops in a much younger age, although it could occur later on. It's usually younger people that develop it, and uncontrolled, it can cause a lot of deformity. of the hands. It's usually the small joints of the feet, hands. But osteoarthritis is the other type of common arthritis. And that's the one that develops at our older age for, overuse of joints, or sometimes just because of joint wear and tear as we age. Osteoarthritis develops. And with that, you could also get deformities, but clinically, they're a little bit different to the rheumatoid arthritis deformities. The best way to kind of investigate that with just a plain x-ray or a good clinical exam, I guess, you could be able to tell if it looks like osteoarthritis, but also an x-ray. Osteoarthritis mostly involves the larger joints. Although the hands can get involved, it's the knees, most commonly. Knees, hips, those are the ones that we see most commonly where osteoarthritis sets in, and sometimes to such an extent that we do need to get joint replacements for that.
Is there a correlation between developing osteoarthritis in maybe an elbow or a knee or a hip if you are an athlete for most of your life, or a runner, for instance, or an avid tennis player?
Absolutely. And in fact, in our athletes, that because of the use and overuse of those joints, they present earlier with osteoarthritis because they're continuously using those joints. So we do see athletes that need joint replacements much earlier than the average population.
Well, right now I can say that I'm healthy for my age. At
Yes,
least I think
you are.
I'm mostly healthy.
You definitely.
Although we were talking about hair loss with thyroid, which of course I did experience, as many of my friends have too, but that is easily corrected, I think, with thyroid. What are they? Hormones, thyroid hormones?
Thyroid hormone replacement, yes.
So I think that's a pretty common thing these days. And I don't know, is it because of the environment that so many people experience it, or does it go up with age? Even men seem to be having this problem now.
Sure. So much more common in women. And yes, age is a huge factor. That's why the thyroid, screening test is included in our average, lab tests that we do on the annual physical, because as we age, it's more and more likely that we become thyroid deficient. Those that have a genetic link, mothers, siblings, aunts, and so forth, that have thyroid disease, usually develop it at a younger age. So often in those that, we pick it up in a younger age, I tend to delve in a little bit more to see if, there's a genetic link, or if we have antibodies to the thyroid. Again, here goes the autoimmune part of all of this. Younger populations may have antibodies to the thyroids, and that's why the thyroid is acting up. But even more common, you mentioned, yes, thyroid disease is pretty common. But as far as hair loss, over the past 2 years, the most common is COVID. We have seen.
I was going to ask you that.
Mm-hmm.
I have several friends who have complained about losing hair after they have gotten the vaccination. And they have not actually had COVID, only the vaccinations.
So it may occur with the vaccination, but it's much, much, much more common with a COVID infection. I mean, to a point where people brush their hair and there's just strands of hair coming out. The good news is once COVID is gone, as long as you're supporting the building blocks for hair with biotin and good nutrition, keeping well hydrated, that hair will come back. So it is, again, what I'm seeing right now, that's the most common cause.
Well, I had a great deal of stress in my life, as you know, just before Thanksgiving, and it continues today. And I've noticed that my hair is coming out, not so much in clumps, but it's coming out quite a bit. And I develop more wrinkles in my skin.
course.
all sorts of things. And I think a lot of people over this COVID lockdown are experiencing the same thing because they've also suffering from mental illnesses, from
Absolutely.
being isolated and being afraid all the time. So I would
Absolutely. I
urge
mean,
anybody to come in and be tested with their doctor with the
sure.
thyroid, as well as figuring out maybe they didn't realize they had COVID.
Sure. Well, Judith, let me just quickly mention, you mentioned stress. And, so I'm one that doesn't blame stress until I've made sure that everything else is, we've
Correct,
excluded.
right.
But we do know that stress can affect our physiology. Stress increases our cortisol levels. Cortisol is a steroid. Too much steroid is not a good thing for our bodies. That's why we don't want people to be on steroids for muscles and endurance and so forth.
Sure.
Steroids can cause problems. I mean, diabetes, heart disease, hypertension, ulcers in one's stomach, osteoporosis. Too much steroids can cause those. And so if we're doing something or we are in an environment where we're so stressed, our endogenous steroids increase, and it leads to exactly those same diseases, those side effects of oral steroids. We get it from our endogenous stress. And yes, losing hair can be related to that as well. Change of our skin can be related to that. Wrinkles can be related to that.
So this brings us to another subject. Beauty is skin deep. We've taken care of the deep part with our physical body. Of course, we always need to have good mental health too.
Oh, absolutely.
But there are wonderful new treatments that can be done that are non-invasive, and you do have that in your LA Wellness Boutique. Can we go through a list of things that are available now and explain what they are?
Sure, absolutely. Yes. So when I started the LA Wellness Boutique, I decided to also bring in the whole aesthetics portion, just again to have these services available, because we not only want to feel great, we want to look great. It helps us to feel great. And many people these days are shying away from the more invasive surgical procedures, because either they don't want to have general anesthesia for whatever reason,
Right.
or they just don't want that dramatic effect of surgery, or they're a little worried about what the outcome is going to be. And so we're looking more and more at more non-invasive means of looking a little bit more youthful. And I use that term purposefully because people want to look a little bit more refreshed. They want to look a little bit more youthful. They do not want 20 years taken off anymore.
Well, I think particularly since we're all living longer to
Sure.
our late 70s, 80s, even 90s and 100, we don't want to be looking like a prune.
Nope. We don't want to be looking like a prune either. Absolutely. So what I have as far as services here at LA Wellness Boutique, I kind of divide them up into two categories. There are our injectables, which include Botox and fillers. They, last, for example, Botox about 3 to 4 months. We have some other toxins that last a little bit longer, namely Dysport. And then we have the fillers. So Botox helps to help with wrinkles. Okay. It relaxes the muscles and doesn't allow those wrinkles to be as evident. Now, if we already have a huge wrinkle set in, we may not be able to get rid of that wrinkle, but surely we can soften that wrinkle by relaxing the muscles around it, as opposed to fillers. Now, what fillers do is completely different to Botox. If you can imagine, when we are younger, the shape of our face is like a heart. And as we grow older, we lose collagen, we lose elasticity in our skin, and we lose some very important structural functions, which are the fat pads in our face. unfortunately, we don't use the fat anywhere else, but in our face, we surely do. And those fat pads are important for holding up ligaments. So if the fat pads are gone, ligaments start to fall, and we start to get areas of volume loss in our face. And so that's where fillers come in, where we can fill areas. And particularly, I like to start with fillers higher up in the face to initially just help to hold those ligaments up, to get that structure or that foundation of our house back, to hold them up. And then we could do fillers elsewhere if we need to correct different crevices or crepiness of the skin or downturning of our mouth. There are multiple other things that we could then, help to volumize with fillers. On the other hand, there are the kind of second portion of anti-aging and what we can do to not look prune-like, as you mentioned, is to do something to build up collagen. So as opposed to the injectables, those are kind of like Band-Aids. We do what we can to make you look better, but they're not solving the actual core problem, which at the end of the day is loss of collagen. And so there are techniques, and the one that I use in my office, but there are different types, is microneedling with radio frequency. The name of the procedure is amorphous. And what it does is with microneedling, going pretty deep, up to 4 millimeters, it releases radio frequency, which is a heat source, develops heat well beneath the skin, and starts the whole process of actually building up collagen. So it's not something that we see results immediately. In fact, it takes about 6 months for all that collagen to build up. But it is a very, very favorable procedure, and actually pretty popular these days, to build up collagen and get that skin tightening back.
So here's a question that a lot of people ask. If you're putting toxins in your body, such as Botox, does it build up and can it make you ill in the future?
So
because it's a toxin?
Right. So the toxin itself is actually very vulnerable. It needs to be refrigerated. If it's out of the fridge for even an hour, it doesn't work anymore. So once it goes into our body, it doesn't last very long. The actual toxin disappears. It goes straight for the receptors of the muscle and it blocks them, and then the toxin's gone. It just denatures, just like any other protein or enzyme that is not kept in optimal temperatures and condition, it denatures. So that toxin cannot build up in our body. In fact, if I mix up a Botox and I forget to put it back in the fridge, after an hour, I have to throw it away. It doesn't work. It doesn't work anymore.
Interesting.
And even when we receive the Botox, it is a powder form initially that we need to reconstitute and add some injectable liquid to. It comes in a powder form. And when the companies send it to us, they have it all wrapped up in ice, because even that powder form, if it's not in ice, it will denature and it will not work. So the toxin doesn't have the ability to build up in our body. It really just it goes onto the receptor, relaxes the muscle, and it's gone.
Very interesting. Now, Botox is able to be used for some other things, like I understand for migraine headaches,
Sure.
for people who perspire too much in their armpits, all sorts of things.
So if you think about it, Botox, what it does, it relaxes muscles. So that's why we use it for wrinkles. But any other disease process where muscles are contracting, a potential treatment would be Botox. For migraine headaches, you have a lot of contractures of the muscles around the head. And that's why there's a whole protocol for Botox where we inject all the way around the skull, all the way down to the neck to relax those muscles. For excessive sweating, how that works, because you're like, well, why would you treat a muscle? Well, for us to sweat, a tiny little muscle is connected to our sweat glands. And when we exercise or when we're flustered or whatever the cause might be that we sweat, that muscle starts to contract. And if that muscle contracts, it releases the sweat. So if we're able to relax that muscle and it isn't able to contract, we will not be able to sweat. So yes, another treatment that is non-aesthetic for Botox. I'll give you another example. Some people, when they are eating, their esophagus, their food pipe, it contracts inappropriately. Now, everybody's food pipe contracts so that the food actually moves down. But in some people, there's too much contraction. And so Botox is often used to relax that muscle so they don't get that excessive contraction, which, by the way, causes the worst chest pain. And some people feel like they're having a heart attack at the time because of the food pipe contracting. So there are definite medical uses for Botox.
Does this esophageal problem happen mostly in men? I have had 3 male friends, older, that have had this problem. And you think that they're going to die, quite frankly.
Sure.
They start almost choking and get just a lot of heartache symptoms.
Right. Well, I think the gender distribution is about the same. I think in the younger population, it's more common in women, and in the older population, it's more common in men.
Well, we'll have to tell them to go get some Botox. Now, is Dysport also able to be used for these medical reasons?
Yes. So, Botox, we just use that term very, nonchalantly. But Botox is the original botulinum toxin that came out. Since then, there have been other companies that have taken over, this whole business and also
the patent expired.
Right. Absolutely, patent expired. And right now there's other forms of botulinum toxin. There's Dysport, there is Xeomin, there is Jeuveau, and then there's Botox. They all essentially do the same thing. They work on the receptor of the muscle to relax it, but they have different properties. So, for example, Dysport, it is known to last longer than Botox. Botox lasts on average 3 to 4 months. Dysport can last 5 to 6 months. So it obviously brings in that convenience factor that you don't have to go into your doctor's office every 3 months to get your Botox. Frankly, it's my favorite just because of that convenience factor. And as far as the outcome goes, exactly the same as Botox. There is no difference. It's the same kind of mechanism. It goes down, relaxes the muscle. And so what better than to be able to get more duration out of that treatment? So Dysport is definitely one of my go-tos. Jeuveau and Xeomin, they're a little bit different. I prefer to use them in the younger population that have never used Botox. They last around the 3-month mark as well. A unique thing about Xeomin is that it is pure toxin. It's not attached to any protein. Sometimes what happens with people that have used Botox for many years, here it goes again, the autoimmune process of our body. We develop antibodies to the protein that Botox is attached to, and Botox does not work that well anymore, or you need more and more of it. So the beauty of Xeomin is that it's a pure toxin, so we can't develop antibodies to stop it from working.
Very interesting.
Yeah.
Most people think they're all the same.
Yeah. And it's funny because I ask when patients was here for the first time to get Botox, I asked them, so what have you received before? I would say 95% of them don't know. I think it's important to disclose, what exactly somebody is receiving.
I think it's incumbent upon the patient also to ask questions.
No, absolutely. 100%.
So How long will microneedling last? And do you need to use a combination of both?
I do. Do we need to? No. None of the aesthetic world is essential. It's just what we like, right? The microneedling and radiofrequency, because we're resynthesizing collagen, it obviously lasts longer than any of the injectables. But you do need to maintain it, because even if you have your series of treatments, your collagen is going to age and it's going to disappear at some point. And generally speaking, so the series of treatments, there are 3 to 4 treatments to begin with. And then to maintain it, it's a single treatment once every 6 months to 1 year to just keep up and maintain that collagen that you have already built. The majority of areas that women really need that skin tightening is the lower half of the face and the neck. And I do not treat the face without the neck. I think they go hand in hand. There's no point in having a rejuvenated face with the neck giving away our age. And most of the time, we actually do need that skin tightening more in our neck than we do our face.
Why is that? Do we sleep wrong? Do we sleep
No,
like this?
No, I just think,
now I need to walk around like this.
There are a few reasons. One is that the types of skin are completely different from our face and our neck. And I actually see that when I do these Morpheus treatments, because their healing is completely different. It takes so much longer for the neck to heal than it does the face. And often we get these little, because we're puncturing the skin with these needles, we often get these kind of sandpapery or chicken kind of feel to the skin, which lasts a few weeks in the neck. But in the face, it may last 2-3 days. So there definitely is that difference in the skin, the type of skin. The other is, everybody tells you about sunscreen, which is absolutely vital. Sometimes the only sunscreen we apply is here, and we forget to actually bring it lower down. And I would even bring it lower than the neck and include the décolleté, the upper chest region, because if you're going to wear a little bit of an open shirt, that the upper chest is going to give away our age, not only with the skin crepiness, but also with sunspots, brown spots, dark spots, age spots. We get those. And so applying that sunscreen all the way down is hugely important.
Particularly my generation, not yours, my generation of going to the beach with the baby oil on and all of that. Fortunately, we didn't do it, but
I was still in that generation, believe it or not. Baby oil and lemon juice in the hair.
Yes. That's it.
Exactly.
Before we have to sign off with you, the doctor needs to see her patients today. I want you to let them know where they can find you. And if you have a website, mention the website.
Appreciate that. Yes, we do have a website. It's lawellnessboutique.com. The website does have our contact information on there. It gives a list of all of our services. Should I give a phone number anyway? I don't know.
Absolutely.
Yeah. So our phone number is area code 818-858-1182. And dear Lindsay is going to be available there. If anybody would like to give us a call, she can definitely let you know about the different services we have. And I do, for this podcast, I am going to be allowing for any consults that want to occur out of this podcast. We're going to do that complimentary. So if anybody wants to come in either for the medical side or the aesthetic side, if anybody would like a consult, just give us a call and Lindsay will definitely schedule that for you.
That's very generous of you. Thank you so much. And thank you so much for being my guest today.
Oh, it's
really enjoyed it. And I think you've just informed so many people what they need to be keeping up to live long and enjoy it too.
Yes, absolutely. So important to feel good, look good, and just get everything out of life.
Thank you again.
You're so welcome. You take care.
You too.
Bye-bye now.
Bye. Next week on Judith Mancini Today, we have two former policemen who have written a book together, So You Want to Be a Cop? Jeff Bonilla and Frank Pickens wrote this book a couple of years ago, but they have also, after retirement, changed their careers, and you'll want to know what they are doing now. So we're all getting where we've decided to do something different in our lives, whether it's because you've retired or because maybe you were laid off because of COVID. There's a whole lot of things out there to explore. Maybe they're your hobbies, your special interests that you never had time for various reasons. And that's what we're trying to help you too. We're trying to help you be healthy, wealthy, and wise. So you can check out our website that is up, but we're still working on it. And I'm going to leave you with these words today. Cherish yesterday, dream tomorrow, and live today. Thank you for joining us today. Hope to see you next week. Same time, same place.
Magazine publisher and entrepreneur Judith Mancini is sharing captivating conversations with experts in their field about the latest trend in our ever-changing world to help you become healthy, wealthy, and wise. Judith Mancini Today will spark your interest and inspire you to lead your